and welcome back to my YouTube channel. I'm Dr. Monica Bartoli, owner and solo physician at Orion Family Health. As you know, it's a direct primary care house call based practice in the South Florida area. So I decided I'm going to make a 3-video series. So this will be video 1. And I'd like to focus on healthcare trauma. And so what do I mean by healthcare trauma? I'm not necessarily talking about malpractice or when people are physically harmed in healthcare. What I would like to talk about is the traumatizing experiences that both doctors as well as patients experience, and kind of give some insight, maybe start some discussion, and create some understanding from both sides of what is the trauma that doctors are going through in our healthcare today, which will help shed light on maybe some of the trauma that patients are experiencing today. And we can see how those experiences overlap and have created kind of this disjoint in the trust of the healthcare industry and field, in the trust of doctors and patients, and in the partnership of doctors and patients. And then at the end, hopefully come together with some of my ideas of how do we overcome these traumas and create a better space for healthcare, specifically the doctor-patient relationship. So the first video, the one that you're watching, will be about physician trauma. And the next video that I will put out will be about patient trauma. And then the third video will be more of an informal, how do these things mix? And more importantly, how do we overcome and make this better for everybody? So I do have some notes that I'm gonna maybe look off screen to refer to so I stay on track, because I could talk about this forever and hours, but I wanna stay focused on specifically the points that I think are important. So I'm gonna talk to you about physician trauma first. I can tell you firsthand accounts since I am a physician. And I just want to start with saying I never realized actually how much trauma and sometimes even how much terror I had been put through in the medical field, in the medical industry, until I really found the space that I'm in now, where I own my own practice and I do my own thing. And I've been able to reflect on my experiences and see the disjointed reality that I was living. And the other thing is listening to my patients recently and getting their feedback helped me analyze, wow, there's some things that are happening and that have happened that are super traumatizing and we need to talk about. So I can tell you, I also see examples daily. I'm in a lot of physician networking groups and, chat groups on Facebook, and daily I get notifications of new group posts, and they're doctors who are just done, burnt out, traumatized, having horrible experiences as doctors, as employees, with patients. And so it's not just me that feels this. So if you're a doctor watching, you're not alone. I'm sure some of the things I'm going to talk about resonates with you. And my goal in this is to make people who are not doctors aware of what we go through, provide some support for my community as a doctor. And then, like I said, in the end, hopefully it starts getting your wheels turning about how can we change this dynamic. So just from an early start, medical school, residency, trauma for doctors starts way back then. We are taught that we are the leaders, that we are the doctors, we are in charge. And we're very much indoctrinated through our training that we are the most important player of the healthcare system. And there are reasons that we're the most important players, and I'll get to that, but we're not the only players. We have co-captains of the team, and that co-captain is our patient. So we're not taught that we're partners with patients. We're taught in a very paternalizing way that we have the degree, we did the training, we know it's best for you. And that's not always the case. So the trauma kind of starts with that grooming that we get. Some doctors have traumatizing experiences with their mentors in medical school and residency. So I can tell you a personal account of mine. I was a medical student in the end of my 3rd year. Some of you know this story. I was in surgery with a attending physician. They asked me what I wanted to do. I said, I have no idea. I'm kind of freaking out. I haven't loved anything. And I've just about given up on what I want to do. And instead of encouraging me and telling me, well, let's talk it out. What are your options? What do you like? What do you not like? They simply looked at me during surgery and said, well, it's not too late to drop out. Sounds like you've wasted a lot of time and money. And if you don't know what you want to do by now, maybe you should just quit. And that was very traumatizing for me. I did cry a lot about it. I ended up finding my passion in the end. So this doctor was wrong, but it was super traumatizing to not feel that support from somebody that I was supposed to look up to and want to be like. So we have those experiences in medical school. We have those experiences in residency. For me, I can only speak about my residency experience, and I had a very positive one, but not all of my colleagues do. Criticism, and feedback sometimes is not done in a respectful manner, and that's very demoralizing and terrorizing. But we make it out of residency and medical school. And it's funny because when we're in it, it's like the worst thing ever. And then when we get out of it and we see what the real world is like, most of us are like begged to go back to residency because it was the best and worst time of our life. I noticed that when I went into the working field, I was like, oh man, I'd give anything to work those 80-hour weeks again and do overnights and 24-hour shifts because it's better than this. So it's a bittersweet time. So once we get into the real world, now a lot of doctors of any specialty are employed. This has been a big shift over years. Doctors used to open their own practices and run their own practice and work outpatient and inpatient and do all the things, do house calls. And we have quickly gone to this employment model. And it's kind of the standard now. I mean, when you are leaving your training, you're looking for jobs. Most people are not looking to open their own practice. They're scared of it. Again, we've been kind of indoctrinated that this is the way it is. You go join a group, you go join a hospital, you go join a corporation. So most of us do. Not all of us have the finances either to open an office. And employed trauma is, I think, one of the biggest parts of physician trauma in the modern healthcare world we live in. So the pros of being an employee is we get a steady paycheck. So just like you with your 9-to-5 job, we have a schedule. We know we work Monday through Friday, not 8 to 5, and we get a steady paycheck no matter what happens. We get benefits. We have vacation time. It sounds like a great deal. We also don't have the administrative burden when we're employed. So we don't have to pay people. We don't have to worry about the light bill, the mortgage, the rent, all that. Our employers take care of it for us. And it is very expensive to cover all those things. But the cons, I am realizing now that the negatives far outweigh the positives. So let's talk about the subtleties. So not everybody is in a workplace that is, just super hostile, but there's a lot of subtle things that create this trauma for doctors. So number one, I can tell you when I've worked various employed jobs now, a few of them, and some were better than others. I remember in my first job, we had 30-minute appointment slots for all patients. So it was wonderful. I mean, it was a dream to see somebody for 30 minutes and be able to do everything. And then very subtly and very quickly, that 30 minutes went down to 15. So we could see more patients in a day. Because more patients is more visits, is more bills equals more income. And it was very subtle the way it was done, and it was quick. There was like no say. And a lot of doctors were really upset about it because the idea of, well, you just need to become more efficient. You should be able to bust out most visits in 15 minutes. That word efficiency was replacing quality, which is what a lot of doctors pride themselves on. So, we were told, well, you just need to get more efficient. Don't ask open-ended questions. Just ask yes or no and get to the point. And this started to make doctors or me feel like, oh my gosh, I have so much to do in this little amount of time. And it starts with the negativity. And then it got to the point where a patient who maybe could come in and we could talk about 2 or 3 things in 30 minutes, now they only have 15. So I have to tell them, hey, I need you to tell me what's most important today and make a follow-up appointment for the next. And it wasn't always patient-centered. And also 15 minutes is not always enough time to properly evaluate and diagnose something. There's a huge list of differential. If somebody comes in and tells me they're fatigued, there's a million things that could be. So it really takes that that quality and we're replacing it with efficiency, and we're missing something. As a doctor, I started to feel like I'm increasing the bottom line for other people, but I'm not taking care of patients, and I'm being rushed and I'm being frustrated. And now I'm seeing 20 patients a day. Where is my reprieve? How do I do what I wanted to do? So when administrative bodies change things on us, that's super, super traumatizing, and we don't always have a say. That can be terrorizing. We also are traumatized sometimes by patients, and a lot of times difficult patients are not difficult by nature. Well, most people. Some people just like to start things or like to be confrontational, but most people don't. And most patients are acting on their prior trauma with the healthcare industry and specifically with doctors. I have been yelled at. I have been called names. I have been demanded to prescribe things or order tests that I did not think were necessary or appropriate. I have had patients tell me they know their body better than me, which may be true. However, I also took an oath to do no harm. So sometimes a patient is requesting something, and instead of allowing me to explain why I think we should do something different, they immediately shut down. And that comes from their trauma and being dismissed in the past, which I'm going to talk about in my next video. So I have had to dismiss patients from practices. I've had to kick people out. I've had to call security. I mean, that's super traumatizing. And as physicians, sometimes I think it's human nature. We start to generalize, right? We start to internalize these situations, and that's where physician bias starts to form. So if I have 5 people, and this is just an example, but if I have 5 people who take ADD medicines and they've all screamed at me and all yelled at me and treated me disrespectfully, well, now every time I see a patient's coming in with ADD or on those medicines, or I read in their history that they might have, my heart starts to race. And I form that bias in my head that this is going to be a confrontational person and this is not going to be good. And so we have to try to erase that, and that'll come in our solution video, but it's real and we don't mean to do it. But as humans, when we have the same thing over and over, think of Pavlov's dogs. We're being conditioned for a response. The same trigger leads to this. When we have that trigger, immediately we start to get that response. So, that's something that maybe patients don't realize, is that physician bias happens and we don't mean to do it, and we need to recognize it and try to do better. One of the biggest, I would say, I'm not even going to say traumatizing, terrorizing things that have occurred in healthcare recently for physicians that I think is important to talk about is the use of the word provider. It makes my blood boil when I see healthcare provider. And I'll tell you why. Provider is a very generic term, okay? It does not tell you the credentials of the person taking care of you. I am a very pro healthcare team person. I think there is a place for nurses, for physicians, for physician assistants, for nurse practitioners. I've worked with some brilliant nurse practitioners and PAs in the past. However, using the term provider is misleading to patients because it doesn't clarify what the credentials of the person seeing them is, and it is extremely offensive to doctors. Those of us who went for a doctorate degree, completed a residency in a specialty, and took the journey to get there. It is not easy, and there's a lot of sacrifice, and a lot of physicians in the community are extremely demoralized and offended by the use of the word provider. Maybe you've never heard that before, or maybe you're a doctor who says, I don't really care what they call me, but you should. Because every time somebody calls us something that is not what we are, it's offensive and it beats on us. When I was a medical student and I would wear scrubs, people would ask me all the time if I was in nursing school. And there's nothing wrong with being a nurse. I think I'd probably be a horrible nurse, but it's not that there's something wrong with being a nurse. It's just that's not what I was doing. I'm a physician. And so it's very offensive, especially when people assume that, maybe based on gender or ethnicity. But some people just, don't get it. And we are not providers. We are doctors. We are physicians. and we deserve to be treated that way and referred to that way. And patients deserve to know if they're seeing a physician or a nurse practitioner or a PA or any other type of healthcare professional. So if you've never heard that before, you've learned something now. It's a big hot topic in the physician community and contributes a lot to our burnout and our trauma and our self-worth and how we can continue to carry on. Another traumatizing thing that goes back to the overworking, right? The changing of appointments, having to see 20 patients a day for someone else. We don't even reap the benefits of all that. Is that we worry a lot, okay? When we're not efficient, good doctors always are thinking, what am I missing, right? We always land on a differential and say, okay, this is what it most likely is. But in most doctors' heads, there's like 5 or 6 other things that it could be if someone doesn't get better. And when we're not able to properly have that time to evaluate somebody and go over all it can be and feel confident in it, I mean, the worry that something goes wrong is incredible. And when something does go wrong, and sometimes it's not our fault, we didn't miss something, it's just bad things do happen and bad outcomes happen, we beat ourselves up over it. We take all of this on like it's our fault, even if it's not. So that's super traumatizing. It's a very high stakes job. And so the nature of it is hard, but adding all these other outside factors to it just makes it worse. And my last point of trauma that I'm going to talk about is about performance. So imagine you go to your job, and we all know what employee performance reviews are about, right? Usually you get a bonus of some sort, or maybe a raise, or at the very least you get to keep your job for the next coming months. And everybody's standards are different. I have never once, outside of training, outside of residency and medical school, I have never once been sat down with an employer and evaluated on my skills as a physician. Let that sink in. All of my evaluations have been about metrics, have been about, did you vaccinate 70% of your patients this year? Did 90% of your patients have a mammogram? Did 90% of your patients have a colonoscopy? Never was it about my medical skills. Like, have you had any malpractice claims? Have you had any adverse events or missed adverse events? Have you had any issues with prescribing, overprescribing, underprescribing, controlled medicines? Have you made any errors? Never about the quality of my work as a doctor. Always about what contributes to the bottom line. And sometimes they'll talk about patient satisfaction scores. I've never had an issue with them. Or they'll talk about how you work with others. Always been a team player, but I was never really evaluated on those things, or it was never recognized and said, well, you've had no malpractice claims, you've had no missed events, you've had no bad outcomes. We're going to reward you for that. Or at least, I don't need a reward, and I'm just doing my job. At least acknowledge it. It's always about how many patients a day are you seeing? You should be seeing 20 and you're only seeing 16. How many colonoscopies have you had done this year with patients? How many this, how many that? All these metrics. And because those metrics are tied to how insurance companies pay the employers. So it's just discouraging to be sat down and looked at as a numbers game and as a workhorse and as a check the boxes kind of job, instead of a critical thinking, using my head, getting people better, and my skills as a physician. So it's very traumatizing and demoralizing. So all of these things I just talked about, they lead to physician burnout, they lead to disgruntled doctors, which in turn goes into that patient trauma experience. So if you've never heard anybody say these things before, now you have. It took a lot of courage for me to sit down and make this list and think about the ways that we are traumatized as doctors in this healthcare field. And I hope it was valuable for you. Stay tuned for part 2, where I'm going to talk about patient trauma and specifically how that physician trauma bleeds in and creates that patient trauma. Thank you for listening and stopping by. I hope you have a great day. And if you're a doctor, we're all in this together. I know sometimes you just want to quit and give up. I quit, and now I own my own practice, and I'm really, really happy, and I'm healing from all that trauma. So if you ever need some support, drop me a comment, send me a message. All of us docs are in this together. Thank you.